Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. So I want to go into what you can do to prepare for radiation therapy. So an overview of that so that you can be ready for it. Um, So when you're getting radiation therapy, or in fact in any treatment, very important to get your full medical history from before, so that you can share it with your medical team and they're aware of everything that is going on. In addition to that, you will want to have your full medication list, so they're aware of all the medications you're taking, including any prescription or over-the-counter medications, any herbs, helpful for your team to know. And if you have any metal implants, so if you've had any surgeries and you've had any metal implants in your body, you would want them to know about that because you're going to be getting radiation. So they would need to know if you're having any metal impacts. So like I touched a little bit on before, when you are getting radiation treatment, you'll want to understand and discuss with your team about how much time do you need to be there, when do you need to be there for your treatments. Is this an outpatient treatment, you're coming in for a few hours, do you go back home, do you need to stay for a couple of days at the site? So you'll want to find out about that. You'll want to have, you may need to have somebody help you to get there or go back home, or you could take Uber or Lyft. So you'll want to figure out your travel assistance. Also, you'll want to figure out if it is affecting your fertility. So if there is an impact on fertility and any fertility related options, if you're considering these treatments, then you may want to get second opinion. You'll also want to figure out your nutrition, what you can eat, when, what kind of changes can you expect, so that you're ready for those. Before they do your treatment, they are going to be fitting you for your mask and doing simulation. So that's where they're going to do the tryout for you with the mask and with the settings so that you're comfortable and everything is set up for you. So there'll be some simulation appointments before. They may suggest if you are smoking to quit smoking. I will let you go into detailed education about if that is the case, then what you can do about it. Also, going through radiation when you're there, it can be a little bit uncomfortable to be still. So think of what you can do that will help you with your radiation treatment to relax. So whether you want to play some favorite music, usually they'll let you take your music with you, so you can take some music. You can do some certain breathing exercises while you are there. If you're feeling anxiety before or after the treatment, then you can also use some aromatherapy, use tapping. It's very, very effective with relaxation or positive thinking, cognitive behavior therapy, or journaling. So different ways to relax. We have a stress management entire series on that, an entire series on self-care, nutrition, meditation, breathing, yoga exercises that you can do when you're going through radiation treatment. So if you're in the NCC program, you'll be able to leverage these. Transportation, this is something you'll want to figure out, how you're going to get there, how you're going to get back, who can help you with this. Again, for transportation, there are some community resources that are available and different options. So you can check out the transportation related presentation in our NCC module. Oh, now when you're going through radiation treatment, it can be energy consuming, it can be exhausting. So you'll want to get some support at home, so that if you have responsibilities at home with kids or other things, then try to get some help so that they're there to take care of you, and you can also get some help and self-care for your food and day-to-day activities. You'll want to talk to your team and understand what is the activities of daily living, um, for you. What is the energy impact on the activities of daily living? As in, would you have enough energy to be able to walk around, to shower, to cook, and do the day-to-day things, or is it going to affect that as well? So that's something you'll want to find out, so that accordingly you can plan your day. Okay, now after the treatment is finished, you can, that's great. That means, it has been effective for your treatment, for your cancer, I hope. But even after the treatment is finished, there are some side effects that take some time, so impact on your skin. It can take some time for the skin to heal. Some of the other side effects, it can take some time for those side effects to mitigate. So know that there are long-term side effects associated with radiation. So you want to be aware of it and prepare for those, so that you can slowly get back to your routine with the understanding that it'll take some time. Also, going through it is, of course, heavy emotionally. So being aware of that and taking care of your emotional well-being is going to be important. When you think of returning back to normal life, whether that is home life, work life, you'll want to keep your energy level in mind, your what your capacity is, and then slowly reinsert yourself. So think about those, discuss those. We have those particular modules in our NCC program, so you can go to those and learn how to have some of those conversations. What kind of resources are there if you're thinking of going back to work, or if you want to have those conversations with your family members or children. Okay. And of course, if you're interested in clinical trials, you can check those out, and also, specific emotional related presentations and workshops are there in the module. There will be follow-up appointments associated with radiation therapy most of the time. So you'll want to make a note of those, track those, put it on your calendar, so that you can make sure you're there going for your follow-up appointments for your radiation, and also for your cancer screening and testing. So hopefully this gives you a sense of what to expect with your radiation therapy treatment, why you are being given the treatment, what kind of treatment, how often, those kind of things, who would be on your team, what kind of things you need to think about, what is the checklist of questions you want to think about, and then how do you address them. Those are things you'll want to think about while you're going through it. And once you're done with the treatment, then how do you reintegrate back into your life and take care of yourself. So hopefully this was helpful for you. If you have any questions, drop us a line. We are happy to support you, and I look forward to seeing you and wish you the very best on your cancer treatment journey. Thank you for your time. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.